Hey everyone, this is Dr. David Song from the Rehab Hero Clinic, and today we'll be talking about rib joint pain as a source of upper back pain. So let's dig deep. So not a lot of people realize, but your ribs actually wrap from the sternum along the front of your chest all the way back to your spine. So as you can see here with Mr. Bones, you can actually see that the ribs join the transverse process of your spine. It forms the costotransverse joint and the costovertebral joints. Now, if either of these joints become irritated, it can become a source of frustrating pain in the upper back or mid-back region. In response to the injury, your muscles will actually start to do something called muscle guarding. Muscle guarding is just a response of your muscles trying to protect you from doing excessive movement that may irritate the joint further. But sometimes this muscular response is actually overreactive and can lead to spasm, muscle hypertonicity, and some stiffness in the area. So what might make you think it might be a rib joint issue? Since your rib cage actually protects your lungs and expands every time you take a deep breath, it can sometimes feel worse when you take a deep breath. This type of pain can also feel worse when you cough or sneeze aggressively. Another sign that this might be a rib joint issue is that when you try to actually get it massaged out, either by a therapist or through a massage ball, massage gun, or foam roller, it doesn't actually completely resolve. Even though this may help to decrease the symptoms you're experiencing by breaking the pain cycle, unless you address the root cause of what's going on, it'll just come back. So what do you do for this type of issue? So since it's a rib joint issue, then doing joint mobilizations for those ribs is going to help with the recovery process. So I'll go over 3 exercises that you can do. So let's get started. So the first exercise that we're going to do is going to use a foam roller. This exercise is called the foam roller prayer stretch. So all you got to do is you're going to start with the foam roller flat on the floor right here. From here, you're going to start on your knees. Make sure you're on a padded surface, especially if you have sensitive knees. And then you're going to place your hands kind of in a mid-pronation grip or thumbs up position on the foam roller. From here, you're going to simultaneously raise your hands overhead while dipping your chest towards the floor. And then you're going to come back up. You should feel this in the upper back in that rib region. And I like to complete anywhere between 8 to 10 repetitions, just one set daily. If you feel some pinching in the shoulders during this exercise, you can go wider with your grip, but try to go as narrow as possible within your comfortable limits. What we're trying to do is gain some thoracic extension, which will help to mobilize the ribs since the ribs attach directly to the thoracic spine. Let's go to the next exercise. The next exercise that we'll be doing is called the doorway rib lean. Now for this exercise, we're going to be using the scapula's placement on the rib cage to help mobilize our ribs relative to our spine. As you can see, the scapula is placed right here. And the idea is that we're going to leverage our arm and shoulder blade to push the ribs forward to gently mobilize the rib joints. So you'll feel the movement along this interscapular region. Now this movement is very similar to the doorway pec stretch, but we do not want to really feel the stretch in our pec. We instead want to focus on this mid-back region. In order to help to facilitate this exercise into the mid-back region and to defacilitate how much we feel in the pec, it'll be important to use the opposite hand to depress the shoulder while we're doing this exercise. This will help to decrease the amount of tension we feel in the chest and remove it as a limiting factor during this exercise. So here's how we do it. First, you're going to place your hand on that shoulder. Then you're going to place your elbow on a doorway in your house. You can then stand in a split stance position. And from here, you're going to just lean forward while keeping your chest orientation forwards as well. So we do not want to twist away, because if we twist away, we're going to feel a deep stretch in the pec. Instead, we're going to make sure our shoulders are squared forward and simply lean in and allow that shoulder blade to push our ribs forward. As with the last exercise, we're going to do anywhere between 8 to 12 repetitions, and this will help to mobilize the joints. You can do this exercise daily as well. So far, we've been mobilizing the ribs through its attachment to the thoracic spine in extension. Next, we're going to go and work its range of motion through flexion. For this next exercise, all you're going to need to do is use that same doorway we used in the last exercise. Make sure you have enough space. The wider the doorway, the better, but you can also use any other stationary object like a squat rack if you're at the gym, or a handrail. From here, you're going to grab onto the doorway frame and you're going to place your feet forward. You want to make sure that when you're doing this exercise that your hips are actually in neutral alignment, which means that you don't want to be sticking your butt backwards, or you don't want to be having it too far forwards as well. From here, you're going to have your hands roughly at chest height, and you're going to just grip onto that door frame while you lean back. Make sure your door frame is nice and sturdy. From here, you're going to then flex the upper back. and you're going to look down as well. After that, you'll squeeze your shoulder blades together, go into thoracic extension, and hold that squeeze for up to 2 seconds and repeat that mobilization that we just did. Just like the last few exercises, you could do anywhere between 8 to 12 reps, and you could do 1 set daily. Just like that. Generally, if you have rib joint pain, doing these exercises daily can help to decrease the pain over a period of 1 to 2 weeks. If the pain does persist, I highly recommend going to see your local sports physiotherapist or chiropractor. Well, everyone, that sums up today's quick video on how to recover from rib joint pain. If you like this video, please subscribe to our channel and leave a like for this video. If you have any questions, let us know in the comment section below. I'll answer it ASAP. If you haven't already, you could check us out on Instagram or TikTok. We have 500,000 followers between the 2 platforms. If you're in the GTA or Markham, you can come visit us at the clinic and we can help you through your problems one-on-one. All right, I'll see you guys next time. Later.